Hi, everyone. Happy New Year. Welcome to our first What Pharmacists Do episode of the year. Today, I'm very excited to have with me Dr. Soha Araji. Soha graduated from Tiro University, California, College of Pharmacy in 2017. So she was one class behind me. And Soha and I really hit it off right off the bat when we met because she was a mom like me at the time, and we always connected through our mom struggle and how to get through pharmacy school with kids, study tips and things like that, outings. So thank you so much, Soha, for coming on and sharing your
Thanks
experience
for having me. And one more thing, you were my mentor. If we forgot to mention that.
Oh my God, I was that your official mentor?
Yes, you're official.
Oh my God, I
Yes.
completely forgot about that.
Yeah.
Yeah, so Soha and I are tight, as they say. Welcome, Soha. Thank you so much for coming on. So
Thanks for
let's
having
get
me.
right into it. I would like you to tell us about yourself a little bit and your career path and where you are today.
So yeah, pharmacy probably wasn't exactly what I was thinking when I was a kid growing up. I always liked it, but I never knew how it is until, I came and I was working, my major was biology. I was working in research. I did my master in molecular biology, working in immunology lab for a long time. That's around 2008 when recession hit, which hit everywhere.
I remember that.
Companies, pharmaceutical companies, biotech companies, and the business that I was in. So then everybody was trying to just find some more stable job. Mostly healthcare was the one for most of the people.
Yeah.
Including one of my close coworkers that she was trying to do the volunteer job for pharmacy or hospitals to see if she likes it. She wanted to apply for pharmacy school. So she said, yeah, you should try it. You may like it, just give it a try. And I did volunteer UCSD in San Diego, both inpatient and outpatient, which I liked it by the time. It was fun. I said, oh, I can do this, and then I started, because I was still a student for master's. I finished my master and started applying for pharmacy school. So then towards I guess when I was defending, that last year I had Sophia. So my daughter was exactly 3 when I started pharmacy school, right? Now she's 11. Time flies.
I know.
Yeah.
So you had Sophia, you were working on your master's.
Yeah, I had both of my kids when I was at school. Sophia in my master's, Cyrus in my pharmacy school when I was doing a rotation. Actually, I went to labor when I was in a hospital. They sent me home, but
rotations
on the same hospital that I'm working right now.
Wow.
They saw the whole dedication, said hire.
You're a trooper. You're a trooper.
Yeah.
So you had Cyrus while on rotations, right?
Yes.
At shops.
Yes.
Anyway, we'll get to that. We'll get to shops later. But then, so you are already in pharmacy school. Well, you didn't talk about when you applied to pharmacy school and,
So what pharmacy school, because my undergrad was outside the country, so I counted as an international student, so which is harder to get in.
Yeah.
So you have to do some classes for just prerequisite, they call. But even though my major was science, I still have to finish that, so which took me a year. Just finish to get everything ready for application. Application. And then I didn't want to leave California because, husband and family. So, and then I got interview and I got an offer. So the first year. So I said, that's it. I don't want to waste time.
So you get into Tiro University. While you're at Tiro University, you get, you do your first 2 years and then you're on rotations at shops. And then you go into labor and you have Cyrus. And you have your baby, and then you apply for a job there, and they're like, well, if this girl can have a
I was their intern.
Here
I was also their intern too. So on my fourth year, I was their intern. So I was in the clean room making all those IV stuff.
Got it. Wow.
Yeah.
Oh, what a fun story. What
Yeah.
an inspiring story, honestly. So now you're a pharmacist at Sharps. What is your fave thing about being a pharmacist?
Just, you're helping people. It's a rewarding job. Any job in healthcare, if you have the opportunity to help people,
Yeah,
uh,
yeah, yeah.
that's
Helping
very
people,
rewarding.
making a difference.
Mm-hmm.
Yeah, perfect. So tell us about what kind of shift you have at Sharp and what you do, like what your duties are as a pharmacist, of course.
So that's the interesting one. It depends on your role. If you're a specialist or just a staff pharmacist, you can do so many different things. So let's say if you do residency and 2 years and you're specialized in ID or infectious disease, so usually your workflow and your responsibility and hours are set. So usually Monday to Friday, morning to afternoon is, you are available occasionally when the stuff happens on the weekends, but your schedule is already set. So, or for example, if you are OR pharmacist, for example, you are again there for most of the surgeries early in the morning and you finish early, depends on the surgeries, and sometimes it's required for you to come on the weekends.
Yeah.
But the staff pharmacist, which I am,
Okay.
we're just verifying orders, all the roles. They are like, it's required 24/7 coverage.
Okay. Yeah.
So so then there are some opportunities there. So which well, you see what you actually fits the best. For me, I work at night, so I work 7 nights on and 7 nights off. So which is very nice, and it helps me to work through my schedule. So because I have kids,
Yeah.
I'm a mom, you're a
Yeah.
mom, my
Yeah.
little one just in the kindergarten, so it requires
Yeah.
a lot of attention. Drop off in the morning, pick up around noon or sometimes afternoon,
Yeah.
feed them and all that. So this schedule gives me the opportunity to help, to not to miss anything. I can still volunteer sometimes. I sleep less, but I still can do what I want to do during the day and nights. So they're sleeping, so I don't miss much. Yeah, and then 7 off is really good. I can do whatever.
Days off in a row. And you can plan your vacations much ahead of time.
Yep. You
You
tell
can,
me what day next year, I can tell you if I can come visit you or no, because my schedule is set, is not changing. While other pharmacists, for example, they do rotation, they do all different shifts and they start different hours. Whereas what I have, it's really nice.
You
at least works
really
for
happy
me.
about. You look like you love your job, girl. You love it. I can see it. I can sense it. So, as a night pharmacist, you do pretty much what they do during the day, right? It's just that you're working at night. You're verifying orders. You're answering the phone. You're making IVs. You're answering codes. You're doing some therapeutic drug monitoring and so on. Is there any one thing that you do that's just like your thing? Like they'll just send Soha for it every time that it happens.
Well, it depends on how much you know. So if you work at the tech level and they have, because you're short staff at night, you don't have that many. There's like we have 3 techs, 2 pharmacists in the floor. So if it is anything happen, like let's say for Pixis, problem or something locked, or you have to go, I go on the floor and try to fix it, even though some techs they know better than me, but I try at least, I try to do it. And then because we are a bigger hospital, we also have pediatric and NICU, so that's why it's required 2 pharmacists always present in the main. So that's the one other thing that it's kind of special for our hospital, if you have pediatric unit or if you have NICU unit. So, and then stuff happens at night. Sometimes they have like not so stable babies. They want to start TNA, even though it's a
TNA. What's TNA? What's TNA? Explain.
Oh, it's just like a TPN, but it's for
Yeah.
NICU. So then, yeah, then it's very specialized for IV pharmacists. But it's like when you work at night, you probably have to know a little bit of everything
Yeah.
just to troubleshoot, because there's no other person to ask. Basically, you are it. And you can't, yeah, you can't call anybody at that time. You try to, you know, choose your battle. Basically, if you can hold on anything, you try to not page the doctor after 12 because they don't like it. The hours, especially something that it doesn't need to be done right away. And if you think, for example, for ID restricted antibiotic that they put there, and it's not the ID physician who orders, and you have to, these are all protocol based. Each pharmacy or each hospital has its own protocol that pharmacists and doctors and physicians have to follow. So then it comes under your responsibility to where to stop it, when to start it, and the benefit or the damage that it can cause if you don't give it. So at that time, so it's a lot of critical thinking, and you have to judge based on what's the best for the patient at that moment.
Yeah, you have to be able to think critically, and you have to be able to work independently and make decisions, be very comfortable making decisions on how to move forward. So if there's anyone out there who is kind of in your situation, because I've been there where I've had trouble picking up and dropping off the kids to school, daycare is expensive, and I've considered working overnight shifts in the past. What would you say is a major difference between day shifts and night shifts for a pharmacist?
So, it depends on the setting that you work in. In the hospital that I work in, it's a very busy hospital, over 500 beds. So, and these days, it's busy everywhere you go. And at nights we have because during the days they have, each floor has its own pharmacist clinical that they look into the patient's profile one by one. They take their time to just critically or clinically evaluate all the drugs, and if it's appropriate, if it's not, and also the discharge consult at the end of the day. But at night, once we have all discharge, probably they start late night, 9 or 10, when they start admitting patients, when the beds are available, they clean. And so then the admitting doctors and hospitalists, they come and put all the orders in. So then you verify a lot of admitting orders. So at night, so you have less pharmacists, a lot of orders that you're trying to verify. You still have to make the medication that is necessary. The IV room is pumping all these IVs. You have to check, send, and then also what else at night? Attending the codes. It depends. If you have an unstable patient, it's really hard to manage, because sometimes there was a time like 3 or 4 pharmacists at night, and then 2 codes happen at the same time. So then it's hard, because one in ER and then the other 2 has to go to different codes. But in my team really help each other, so they offer to go, like ER goes, and to keep one pharmacist at least in the main, just in case if emergency happen and things.
Yeah. Thank you, Soha. So I'm just gonna recap. Since we started doing these videos, so we're always showcasing, what pharmacists do. And in the hospital, when you go to the hospital and your nurse brings you a Tylenol or that injection she's going to give you for pain, or an antibiotic, they all go through the eyes of a pharmacist. No patient gets any medication unless a pharmacist approves it. And Soha does all of that in a much smaller crew, in the skeleton crew, because it's nighttime. Most of the other staff is at home. So what I gather from this is that you have to be able to really think critically, know a little bit of everything. And you've been there for 5 years, so you pretty much have seen most of what happens in the hospital, all the scenarios. So if you're considering a night shift, you should be confident in yourself, and really be able to work independently. and teamwork, especially with your pharmacy technicians. I've always said that my life is impossible.
Yeah, a good technician makes you look good.
Absolutely.
Yeah.
So teamwork and being able to have that interpersonal relationship with the little crew that you have.
One other thing, you should be able to do multitasking. That's the key for night, because the phone keeps ringing. You are verifying orders, and their stuff that they handed to you here and there, sign it. You are in, your brain is in 3-4 directions, and you're still not allowed to make any mistakes.
Right? But it's patients' lives, and
I understand.
We're cool with not being allowed to make mistakes, so we don't want to hurt any patients. And so your story is so inspiring, coming from another country, having your undergrad degree in another country, getting a master's degree here to kind of match the academic requirements of this country, getting a job that you really like as a research guru in a big company, but with the recession, things happen, people get laid off, and you're able to bounce back and choose that second career. And you chose pharmacy, and you were able to adapt pharmacy to your lifestyle. You're a mother of 2 young kids, and because of the flexibility of the careers that you can get in pharmacy, you're able to get by just fine. And I know, I can feel that you really love your job, you really love what you do, and really thank you for sharing your passion with us. One last thing, if there's anyone out there who wants to get into pharmacy, what advice do you have for them to make themselves look capable on the application?
On the application, or in general, I would just say, love what you do and work with passion, because it goes a long way in whatever you do, whether it's pharmacy or you are in biotech company, or even you're cleaning the house. The people who like, they're proud of what they do, and they do it with pride. They usually it shows, and it goes a long way.
It goes a long way.
Yeah,
that's the great advice, even for starting up the new year, right? Just do what you love.
Do it with passion. Just think about the people who are you serving. It could be your family member. It could be you someday. So just get the best service you can at at your level. Because I'm not a doctor. My hands are tied. I can just do what I'm allowed to do. So it depends on the level of a passion or compassion, how much you really go in, dig in, and you find a way to help these people. Doesn't matter which setting you work in. Just try to do your best.
Absolutely. This was so good. Thank you so much, Soha, for coming and giving us all these pearls.
I know, I miss you so much.
Hopefully I get to come to San Diego soon and see my babies. All right, this is over. Let's hang up so we can talk offline.
Sure.
Correct.
Bye.
Bye.